Hello, this is Dr. Kelly Hood. This video is for those of you that have been diagnosed with peripheral neuropathy. Most of you have been told there's nothing that can be done for peripheral neuropathy. And I'm here to tell you that is absolutely just not true. Most of you have been prescribed either Cymbalta, Lyrica, gabapentin. Those drugs are anticonvulsants, anti-seizure, and antidepressant type drugs, which are used off-label to help mitigate symptoms of peripheral neuropathy. In my office, we do a functional neurological exam. We do a very thorough history to find out why are you having peripheral neuropathy. I will tell you that 60%, somewhere around that amount, of diabetics will develop peripheral neuropathy, and the reason that diabetics are at such a high risk is because of the excess sugar in their blood. So one of the main pushing underlying conditions that a person has, blood sugar issues, is pushing you towards potentially developing peripheral neuropathy. Also, if we have low oxygen in our body, it's going to lead towards potential problems, again, such as peripheral neuropathy. If we have compression, let me show you what I mean by that. In the lower back, at L5 and S1 area, we have a disc right there. Many times that disc has gotten compressed. That affects the nerve see right there? That is the formation of the sciatic nerve. And then we flip it around here. You can see how big that nerve is. That nerve comes down through the sciatic foramen and then through the hip, down the back of the leg, all the way down to the foot. So L5 and S1 nerve compression is a big player for many of you that have peripheral neuropathy. Then, if we are having any type of a stretching type injury, could be previous surgeries to the low back, to the hip, to the knee, where the human body has been opened up, stretched. Oftentimes that can cause damage to the nerves that then go to our feet. So therefore, potentially causing peripheral neuropathy. Those of you that have been through chemotherapy, radiation treatments, that's another thing that can cause peripheral neuropathy. So the way we treat peripheral neuropathy is we treat the person that has peripheral neuropathy and not throwing medication at the symptoms of peripheral neuropathy. If this makes sense to you, then come see us. We've treated peripheral neuropathy for years, and yes, there is hope. But also understand that there might be some things that you need to do to help us help you. And one of those things is diet. There are certain things that we eat, such as gluten, that can cause inflammation in our gut. That tends to cause what is commonly referred to as leaky gut. That means that larger than normal proteins that aren't being digested properly leak out of our gut directly into our bloodstream, which is an invader. It shouldn't be there because it should stay in the digestive tract, but when it gets out into the blood, it causes inflammation. And that could be another reason why you're having issues. So we're going to look at all these different things that you probably have never had looked at before in hopes that we find what is truly causing the cause of your peripheral neuropathy. Yes, there is hope. There is treatment. But you need to take action. Come in. Let us evaluate you. Let us do that functional neurological exam. Let us dive deep with you and see if you are one that we can help. I will tell you, if you're too far gone, I'll tell you, you're too far gone. I can't help you. And we have different screening methods that we can do to see if you fall within the realm of being able to help you. And remember, some of the help you will need to do on your side to help us help you. Again, this is Dr. Kelly Hood. Thank you so much, and hope to see you soon.